to be live, and how funny is that? Here we are. Oh, it says, okay. Everyone who's looking for us, we're having the best conversation ever. And we realized that we didn't hit the go live button. This has now been like 15 minutes we've been chatting. And people are like, we can't see you. When does this start? And we're like, well, wait, we're on right now. Wait, hold on. We're gonna have to go back and have this entire conversation. I wish it was recorded. It was a really great conversation, y'all. All right. So we had I thought I had aired all of the intros and all the things for tonight's conversation. And then we went into a whole thing. But this is what happens when you're in your live, who knows what's going on. So Neshe, we were like so deep into conversation that I don't even know how to replicate where we were. But let's try to backtrack ourselves back there because we had a really great practice session without anybody watching us. We were just chit-chatting. It was great. All right, everyone. So we're here with the Social Impact Level Up Live. This is Wendy B. Of course, this is live on LinkedIn, YouTube, and Facebook, which means that if you're watching this finally, we are about 15 minutes delayed, but that's because we were having a great conversation without you. We were off on the topic and it was fantastic. I was learning so many things. And then I didn't really just realize in the comments, like, where are you, Wendy? And I was like, oh, we're here. So it's live. It's real life. It's good to see you guys. Thanks for being here. For whoever is here, I think I saw Diana, Yvonne, Sonia. We mentioned all of the people who were on the feed when you came on. So if you left a comment and told us that you were here, sorry that we missed you if you're not still watching. If you are still watching, here with us, hang out because we're going to get right back into it. So, okay, let's start all over again. Good to see all of you guys being here tonight for the Social Impact Level Up Live. We're here to talk about advanced storytelling, which is part of the Up Level Your Story Challenge. The link to the challenge is in the comments, but also if you have any questions, you can feel free to drop those in the comments as well. We're talking to Neshe Conley, who is one of my friends that I was fortunate enough to be connected to through our friend Dr. Enyego. And Neshe is one of these people that has a bunch of knowledge in the space of public health and communications. And we were talking all about, without you guys, how do you bring in two concepts, that are part of the challenge this week: community, and how do you bring in the concept of where you're segmenting your audience and delivering your message specifically to different groups of people. So we're going to get right back into the conversation so y'all can join us because we were having a great time. But I'm going to turn it over to you, Neshe, and apologize for somehow not making you live. Oh no. And I'll put the link back in the comments, Sonia. So Neshe, tell me more about you and what is it that you do and how do you help social entrepreneurs and people who are trying to communicate to a community?
Yeah, so my name is Neshe Conley. I do have my master's in public health, as well as I'm a certified health education specialist. So I do a lot of health programming for the community. I work with a lot of nonprofit organizations, small businesses, social enterprises, and community leaders to maximize their impact on like online, like social media, as well as in-person events. Let me see. Trying to think. What else can I add? Oh, well, I started my company, Elevator Co., because of my own upbringing. I depended a whole lot as a child on community resources and just health education that was provided through like local churches, the local universities. So I knew that I wanted to have that same impact for somebody else that been through what I went through or going through what I went through as a child for them and their families. So that's how I help my clients by learning how to communicate on a level that is more focused or more personalized for their ideal audience or clients. They go through a lot of names. So some say community members, clients, guests with the different organizations I work with. I don't want to leave anybody out, but language is really important in the work that we do. So I help them to maximize their outreach by connecting with them, understanding their aspirations, understanding the gaps of what they have accessible to them and what they desire to have in their communities to better promote their health outcomes.
I love it. And I hope that everybody's going to be able to hear all the fun things that we were talking about before so we can get back into this conversation because you had so many great things to share about the community and about who you serve and how are you communicating to them. So those are the topics that we're going to talk about today. I put the challenge link back into the chat. So if you missed it, it's in there. And I wanted to go skip right back into the idea of engaging community in a conversation through your communications and your storytelling, because tonight's episode is about advanced storytelling. And you were talking to me earlier about something that was really interesting, which was when you're communicating to the community, there's ways that we do this work. There's reasons why we do this work to reach the right people with our messaging. Can you re-explain and tell people about that? What is that? How do you connect with the right people in the community, or how do you define community? Because that might even be a word that people use in different ways.
Mhm. So, how we define community is a group of individuals that have a common or shared interest. So, you can be think about economic status, social economic status. You can be low income, middle class, or high income. That's a community that you're a part of. You could be a mother, a father, a single parent, married parents. You can be, clearly ethnic, African American, Latino, Asian, Caucasian. You can be homeless. You can it's just many different communities. But when you one share a same interest or similar interest to somebody else, you build that community because y'all have the same experiences. So that's how we define community. But with that definition, we use a concept mapping strategy that allows us to break down different health disparities or segments that are caused from a particular issue. So as I was mentioning, February is American Heart Health Month. So we focus a lot on how to have a healthy heart, what to eat, physical activity, strategies, and health, right? So when you think about it, that's a community within itself. If somebody's experiencing some type of health issue or health disparity, heart health disparity, then they're a part of the same community. But I may not look like you. I may not have the same economic status as you. I may not have the same resources as you. So that's when we start to use that concept mapping to say, hey, okay, this is the bigger issue. So let's break it down to different segments to be able to identify the language, the demographics, and that understanding of what are the gaps, what are the aspirations for each of these different segments or these groups. So that's what we use. And kind of definition of a concept mapping is just like breaking down. We like to use that, like just breaking down details to where all of it kind of comes together. And we have different areas that we can tackle when we're creating our storytelling and our content or our products and programs. You can also use that to say, hey, I'm realizing that this range, 35 to 40, have a higher risk of experiencing cardiovascular diseases because they are starting to be less active, eating unhealthy. Like it's just many different life factors, right? But because we understand that one little component there, when we create that storytelling on that product, we can say, hey, this is the demographic that we are attracting for this issue. So we create the content behind that, the graphics, the reels, understanding what they're engaging with on the platforms, even in person. We do a lot of stuff in person as well to allow them to have that education, that knowledge, understanding too what they're used to as they was, growing up. That plays a big part of it. You're not going to bring technology strategies to a demographics that might be 75 and older. They're not used to that. They're not comfortable with that. So they may want you they may want some like paper, or they want something that's in person or a phone conversation, or is different. But when you go to the younger demographics that may have a risk of getting this because they are experiencing obesity, for example, like childhood obesity. They're all in technology, they all in games. Make it animated, do reels, do videos. That is what's going to grab their attention. So I say all that because with the concept mapping, it allows us to see what is popular, what is comfortable for that community or that demographics or that segment to where we can best serve them.
I love that because the community definition you gave to me earlier was like it's around the shared topic. So it could be something that is defined in a lot of different ways. It's not always gender or age demographics, but it could be shared life experiences, or it could be, I mean, it could be location, but it doesn't have to be location specific. There's a lot of different ways to define community. And some people even have like their own following or community of people.
Mhm.
So, even within that, thinking about that, different people need different things or need to hear things in different ways or see things in different ways. Can you explain a little bit more about like why the practice of like augmenting or segmenting your audience or like campaigns? Like, can you explain some of these really basic things so that people understand the benefits of not only the mapping of it, but the component parts that they need to look at in order to do the mapping?
Yeah. So, first, kind of talking about like campaign. So, when you think of a campaign, you think of a idea that you are strategically putting together to promote a certain issue or a topic. So, you can have, for example, like February is Heart Health Month. That's a campaign that we're doing. We're also working on a mental health campaign. So we do the research, come up with the primary and secondary data. We figure out the demographics we want to, attract or engage with. We also figure out exactly what are some of the resources or the gaps or the issues that's currently happening within this social determinants of health or this issue within in general. Um, so when it comes down to campaign, is whatever topic you're trying to promote and bring awareness to. Now, when I think about why it's important to really segment your audience, because we did this, we had this client previously that was into the metaverse. She was bringing wellness to the metaverse. She was a ER provider, and her audience was or is healthcare professionals, active healthcare professionals that also will be interested in, exploring the metaverse. Now, we know the metaverse is something new. Everybody still don't really understand it. Some people are really uncomfortable, but that concept mapping and that engagement really allowed us to identify exactly how could we create content, how can we create that messaging, because at first it was healthcare providers, but all healthcare providers is not open to learning something new, early adapters. Everybody is not, right? So we had to figure out exactly, okay, maybe they have to be interested in IT as well, because that's another thing that's a part technology, a part of the metaverse. We realized that it was a certain age range, like it was more of the medical students that was engaging more than like the older healthcare professionals or providers, because they couldn't navigate the computer by itself or the platform by itself. So I use that example because it's really important to understand all the components that will make your program or your product or your communication in general have that maximum success. If you really break it down a whole lot, that my outcome or my goal is to, let's just make up one. My goal is to have 80% of African American women that have 1 to 2 kids already or new moms to engage in our product. Now, you have to get detailed like that. You have to, because it really helps you in regards to your process of, okay, where are they, for one, what is the issue? What is the gap? What is their aspirations? What are they lacking so that we can understand how to communicate? Because if they're not lacking a product you're trying to sell, they're not going to purchase your product. They're not lacking in that, but they may be lacking in, say, birth control resources. I'm just going to say that. I'm just throwing something out there. Or breastfeeding. Let's say breastfeeding. breastfeeding resources. They understand like taking the prenatals, exercising. They understand that's important. So why are you going to promote or include that into your storytelling if they already understand that? If that's the demographic that you're trying to reach, but they don't understand breastfeeding, they don't understand, how it works, the different techniques and strategies. And I say this because I am a breastfeeding mother, and it took a lot. It's not just what we think is just easy to, you know, have your baby to attach to you. Some mothers have issues with that. Why do they have issues with that? Is there a certain nipple shape that I'm getting I'm getting real public health in here, so I'm starting like I'm a mom, like I said, I'm a mom, and I'm just like I'm so comfortable when it comes out to talking about this. But there's so many different factors. So if it's somebody that's struggling with a certain nipple shape that their child is not attaching to, or if it's the lack of them drinking, because you got to drink so much more water. But what is that so much? What is that, and why is that? Do they have resources to clean water? Do they have the funding or the availability or the time to make sure that implementing drinking water is these questions that we like brainstorm to kind of make sure that we can get down to the common issue for this community on how we promote or how we present the information. So kind of just using that allow us to hit our outcomes and hit our goals at the end of a campaign because we know in detail what we're looking for.
And I love that because you described a couple different things in your description, and we talked about these before as well. It was about, the population of focus, like who exactly are you serving and how are you serving them, and what types of interventions do you have that are related to what they need. But then also the idea of community. I know Yvonne had to leave, but Yvonne was the person who inspired this comment. It's this, like, what exactly is the community asking for? What is the community empowered to be part of as a solution, so that we're not just like constantly like doing things and saying, oh, community, just accept our solution, but really being able to take advantage of the talents and the resources that naturally exist within our communities. So going back to this idea, not only of the segmenting audiences and connecting to people, but how do you really start to do some of this work of bringing in the community voice
Mhm.
to the solution and the presentation of the solution that you're doing through this storytelling or through this communications and marketing?
Mhm. So what I like to tell like my team or people that I come in communication with is that I work beside the community and not for the community. I work beside them. I do a lot of surveys, polls, through like email marketing, through social media platforms, even in person. We'll go to like a health community center locally, and we will engage with the community, ask them, okay, this is the topic that we're trying to address. Tell me how you feel about this. What do you know about this topic? What are some resources around here? And I kind of got that idea. It's called like a windshield method when we will drive around a lot of different communities, like lower income communities, or per our research, communities that experience a certain health issue have a higher risk for it. We see exactly what's going on with them, but we also communicate with the community leaders, the gatekeepers, and that's key. That's key. First, I want to start back by saying that with working with the community, you must gain their respect and their trust. They have to be able to trust you, to respect you, to open up to you, to say, hey, I trust you with my information. I trust to get information from you because we have that relationship. So that's key. That is key. When your community understand that you experienced what they experienced before, that's another thing. They love that, to say, hey, I've been there. I know how this feels. I know what it looks like. And this is how I got from point A to point B. And this is how I can help you. But not being afraid of them. Because a lot of times that's a big issue, to be completely honest. And I'm really a transparent person. That's a big issue when it comes down to public health sometimes, is that a lot of the public health leaders or professionals, they really don't go into the community because they feel like, as you mentioned, they look in, like I think it's called like up down method, where they just look in and say, okay, this is what the research says, this is a good solution. but the research may be for a different demographic, a different age, a different area, and it may not be effective for this one. It can be at the same time, but sometimes you have to make those adjustments. The way to make the adjustments and to have maximum impact is to make sure that you talk to the community members, because once they know that you're truly empathetic or sympathetic to their situation, they will be more willing to engage. They'll be more willing to support you, because they feel like they have a say so in what's happening within their community. So that's how you can have that strong impact, and you can do that through storytelling. Like, you can do that through storytelling. You can use case studies, for example. Um, or the Raina, I love that you said yes. Right?
Right? It's like this is seems so logical. In some ways it is, but it also is a skipped practice to get feedback from the community and genuinely engage. And one of the things I try to teach people about is community participatory budgeting.
Yeah.
And you had started also talking about community participatory research.
Yes.
And these are things that they seem like big concepts, but honestly it's holding the space for
Yes.
voices that are traditionally disempowered and not invited to the conversation, slash
Yes.
the conversation is not really made accessible to them for
Yes.
them to participate in these processes that ultimately will give them services or give them resources or give them access to things that honestly people should have had anyway, but a lot of the time we're like correcting prior mistakes here. So I think that, when I think about community and how we engage community in these not only communication strategies, but also in decision making strategies
Yes.
or in resource allocation strategies,
Yes.
there's really a lot to be done, to be practiced, to
Yes.
be like almost demystified for people to understand that it's not scary. And
Yes.
in fact, it actually makes you better. So I don't know if you want to say anything about any of that.
Yeah, so kind of a little story I love to like tell. When I used to work in the healthcare field, I was actually a an ambassador for my health network, one of the ambassadors for my health network. And what I realized is that through that experience, I was blessed with the opportunity to do an initiative called Walk in Their Shoes. Now, my hospital, my old hospital, was in the homeless population of Fort Worth, Texas. So that was probably about 80% of our patients that came into the ER. Um, so when I participated in this, mind you, I had experienced some struggles in my life, of course, because financially, it was more of that lower level economic status, social economic status. But I never had to experience what they had experienced. So the whole initiative is that from the hospital, we had to walk to the shelters. So we had case studies. So we was discharged from the hospital. They gave us our identities. We walked to the shelters, which was probably about like 5 miles, I think. So some of us had to walk. If you're getting discharged from the ER, you may be on crutches, you may be in a wheelchair. So other employees, healthcare employees, where one was in a in a wheelchair, one was in crutches. One had to carry like 3 big bags of, I don't even know what was in there. They had to carry like 3 big bags, because this is typically what happens when a lot of our patients are discharged. So when we got to the shelters, some of us was accepted in the shelter. Some of us wasn't. So we had to stay out on the street until the next day, until it was open again for us to go in. Technically, that's how the whole program or initiative was created. Now, I tell that story because that was the first time I really understood that we don't really understand what's happening. We really don't understand. And it kind of relates to with a lot of people in your employment in general, right? When you have, like, they say like the suits come and they tell you, they implement policies and implement, procedures, and you're looking like, that's not helping me. That's putting more work onto what I have to do, but you also want me to do this and talk to 50 patients a night, but then you want me to run this and admit this and do this. How did you feel when somebody that's not in your shoes is delegating and telling you, okay, these are the solutions to make your job better, but it's really not? That's how you have to look at storytelling. That's how you have to look at connecting with your community. You have to really experience it, talk to them, and say, hey, what can I do to best serve you beside you, not for you? I need you to be able to have that major impact, that maximum impact, so that we can have the ultimate goal of serving and give you that positive health, outcome. So that kind of go off into what you're saying that I experienced, and I would never forget that because it changed my perspective about how to engage with my patients.
Oh man, you're hitting me with like the real because as a policy person, this was always my fear, right? Like being in the federal government and then being in the local government, that we would be making decisions about people's
Mhm.
lives with blindly because we were simply too far up to be able
Yep.
to really see the consequence. And when a lot of my grantees or people would come to me, or even my staff members would come to me and they'd say, hey, this doesn't align with, or the research says this, but then there's this other thing to think about, or these community groups that we could align with who are prefer to do something this way. I
Mhm.
think that you have to be open to those kinds of conversations, and
Yeah.
not as a leader or as someone who's making policy decisions or making advocacy decisions, to not look at all of the evidence that
Mhm.
includes and should rightfully include a lot more representation from the community.
Mhm.
And I think a lot of the times we skip that because it's quote unquote hard, but it's
Yeah.
only hard because we don't build in the off season, whenever, all the time,
Mhm.
the connection to community to be able to simply get that feedback and to go
Yeah.
about correcting, or to go inform a grant or a process or a program or whatever.
Mhm.
And a lot of the times, because we don't have that access to the community, we kind of use that as an excuse not to engage the community. So it's almost like we do this to ourselves, but then we sit there and we say we want to engage the community. We talk all about community engagement in a meeting without the community.
Mhm. And then what gets me is that a lot of people say, I want 100%. We're all about like outcomes. You know, we want 100% participation from, I'm going to say the gay community. I'm just going to say that. Um, Okay. So what does that look like? Who are you trying to reach? That's a large community, you know? There are different aspects, there's different language for one that you have to address when you're engaging with them, when you're, creating that storytelling or that program or that product for them. You have to understand exactly what their day-to-day look like. You have to really understand exactly what is already out there, and that's that research, like, okay, scholastic articles, from medical providers and all that. And I want to say this, that I'm not neglecting anything that's been done before. Clearly, these professionals are doing their job because they have expertise in that. But what we like to do in my company is that we get about 10 to 15 different resources, and then we have like this document that we point out the gaps for each article we read, and say, okay, what is missing here, what is missing there? And then we create a program or idea based on those gaps. We're not going to repeat something that already had been created. That's not helping us to do anything. That's not helping us move the needle for these communities. So we figure out exactly what are the gaps, and then we engage with them. We show them that we care. We're not just here to tell you this works for you. How do you know that works for me? Have you been in my shoes? Have you been in my communities? Did you see this? Did you see that? Like, just because it worked for them, it doesn't mean it works for me. So understanding exactly that, research, making research results done. Sorry, like these comments, I'm
I
loving
wanted to get to this comment
it.
because it's been waiting for a minute, but we should definitely talk about it because you're about to talk about it. It's from Marina. It says many research results done through the community don't make it back to the communities, especially those facing language barriers, before proposals or investments are drafted. Including community in planning takes work, but it's so valuable. And I think it's like including them in the planning, but then also maintaining a power structure where community is going to be part of the solution as the solution is implemented, and if needed, augmented or changed through a continuous quality improvement process, right? Because that's where the community feedback really tells you if the solution you put in place is going to be the actual solution needed.
Mhm.
And it's like we don't go back, and even after a needs assessment, I've seen grantees do this really well, like go back and give the results of a needs assessment to the community
Mhm.
members who participated, and
Mhm.
then also to people who weren't even there, right, in different ways. How do you get information, disseminated locally?
Mhm.
And I think that sometimes we skip those little tiny steps because it just seems like, um, well, I needed that for this purpose, but not necessarily didn't think through that somebody would question what I did with it,
Yes.
right?
Yeah.
And in order for people to build that trust, like you were saying before, you have to go back and tell people what you did with their information. And you
Mhm.
should do something with it, right?
Yeah.
Like you shouldn't just collect the information then not do anything with it, or
Mhm.
not use it to inform your programs. Like
Yeah.
you really should actually genuinely use that information.
Mhm.
So all of that to say, I think this is a beautiful comment. Thank you, Raina, for dropping
Mhm.
that in there. So
Mhm.
I'm gonna let you give your thoughts on this comment too.
No, I love this comment. What I will say is that from experience, I had this happen where we collected data. We did some outreach with my health network. I was doing outreach at the time as well with them, and we would go out into the communities, and we was doing grant work. So we'll go out, we would just have them fill out the application, their name, collect the information, and then just take it back. We missed a huge opportunity for one, understanding the demographics of the community that we was in. We realized that when we first went there, we wasn't prepared because we had English as well as Spanish consents, because we knew that was the two major, languages, native languages in Texas. But we had a large influx of people that spoke. I forgot I can't pronounce. I do not. I hate messing up words, but it was more of like an Asian language. I forgot what it was called. It started with T, but yeah, I forgot what it's called. But I said that because if we was better prepared, if we actually went out there into the community, knowing that we was coming out there to give flu shots and to provide like medical assistance for our network, we would have been able to reach that family or reach those individuals, because we already had that community assessment. And we do a lot of community assessments in our work, and it can be something like, oh, that's a lot just for me to create a brochure, or an infographic, or a product. It's a lot, okay. But one thing that I learned is that when you engage the community, it makes your product, makes your outcome more credible, because people can't come to you and say, how did you get this information? How do you understand that? That's not right. No, I spoke to them. That's right. Now, this is why yours is not right, because you didn't engage with them. I understood exactly what they say. I understood the mission. And I went out there and I really engaged with their language, especially when it comes down to language barriers. You have to meet them where they are. You have to meet the community where they are. I can't go into certain communities and use public health terminology, because they're gonna look at me like, what are you talking about? What is that? Now you're missing a big opportunity to learn more about what they're needing, because you're trying to show off, that I have this book smarts. No, be meet them where they are. If they are on a reading level of, let's say, fifth grade, plain language, talk to them. Don't diminish them. Don't downplay them, because everybody life and everybody experience is different. Just meet them where they are so they can feel comfortable. And that makes it more credible, the information that you get, as well as you can have so much more impact when they feel comfortable with you, and then their neighbor gonna feel comfortable with you. Then you got the whole community behind you, and you probably don't even have to put in that much work. It's so simple. It's so simple, but we really just think it's, those small steps that's unnecessary, that can really close a gap within the issues we're having in community health.
Yeah, and I love all the comments, and thank you guys for being here, Ladoris and Dr. O and Raina, and I think we saw Diana and at some point Yvonne and Sonia. Good to see you guys. And I think that the things that you were talking about, Dr. O kind of mentioned in this comment as well, that it's important to do the quality assurance and quality, then the QI process. So the QA QI process, but quality assurance and quality improvement process with these interventions. Not only does it create the broader sense of transparency, but it also reinforces the trust bridges. And I think what you were talking about with the transparency is really important for organizations and social impact organizations to have that sense of community transparency and to be able to connect and say, we've used your feedback in this way and
Yeah.
it was valuable to us or it was helpful to us. Like, I think that statement to people and to the people you serve or even the community at large is really powerful and
Mhm.
can help with very tangible things like volunteers, donors, clients actually coming to your programs, new clients who might trust your programs because they think you actually are being transparent. Like,
Mhm.
there's so many
Mhm.
different benefits to doing
Mhm.
this as part of not only your QA QI process or your planning processes, but also your communications processes, and
Yep.
then your out, when you have the outcomes, being able to communicate those outcomes and say, these are
Yep.
ways that we make an impact. If we decided to change things, it was because of feedback we got from our community that we serve or from the community at large. And here's how we changed it. Here's how it's improved our outcomes, or here's how our outcomes have changed. Like, being transparent that you made a pivot or you changed something as an organization as a result of feedback is
Mhm.
really, really, really important. And I think sometimes people will just almost like gloss over it and not empower themselves to use that as a strategy to get to further their storytelling, to further their communications goals.
Yeah.
And so I love the stuff that you're talking about. I think this is a really good topic, but if you want to mention anything about this comment, feel free.
Yeah, kind of going off what you were saying too. The first thing that popped up in my mind was when COVID first happened and we started getting vaccines. Right, we had that vaccine hesitation, whole thing where people was really hesitant with getting the vaccine. Um, Talk, and especially people of color. We were nervous about, I'm gonna say we because I definitely got vaccinated, but people of color, majority of us felt uncomfortable with getting the vaccines, and it's because of the Tuskegee experiment, because their trust of the public health system, right? So this is a concept of using that transparency. We had national organizations creating content, creating media based on, like, okay, the data or the results of African Americans not getting vaccinated and what that can do to you, and blah blah blah, all that stuff, right? But they did not once talk about exactly that big gap, that gap of trust that the African American community had in regards to testing, should we say, with the Tuskegee experiment, they had, the drug the whole time. I think it was like 40 years they had penicillin, but never gave it to, the men of the experiment, African American men of the experiment, and they was dying, and their families was having to pay all this money, didn't have any medical insurance. That's a whole different conversation for a different day. But it aligns with storytelling and having that community impact, because you have to fully understand that, okay, the reason why African Americans is not really receptive to getting vaccines, or having that hesitancy when it comes to getting vaccinated, is because of this situation here. How can we build their trust back? That was a big gap that was missing with health communication, and that really was got me started in health communication, because have you took the initiative at a time to really listen to that population, that community? Was it just African American men? Was it the women as well? You having a lady, African American woman, going on TV getting the first vaccine, and then she, I'm glad that everything is good and she's better, of course, after the situation. And she wound up like fainting and not and getting sick from it. That wasn't a good way to try to promote for us, for the African Americans to get vaccinated. I'm completely honest, right? So is that understanding how we can really maximize our impact to solve a health issue, and knowing where it is stemming from. That's so important. So doing, like, the QA QI is really like, okay, let's figure out exactly the whole picture, the whole concept of this intervention or this programming, and then use that structure or that image to build a powerful storytelling that can go into a campaign that's going to increase your outcome for what you're trying to achieve. Be transparent, communicate, and connect with the community that you're trying to target.
Yeah, and I think that you're also helping to make things easier for people to adapt or adopt, right? Because
Mhm,
prevention is something I talk about this all the time in my content, that people not only do they not understand prevention, but prevention communication and getting people to engage in preventative interventions.
mhm,
It's really difficult because the return on investment is
mhm,
something bad does not happen,
mhm,
right? And so
mhm,
when the negative outcome isn't an immediate, like, I don't have a consequence right now, or I don't have a reward right now. It's like
mhm,
you're promising me that maybe something won't happen to me.
mhm,
It's a little bit more difficult for people to buy into. And then you layer on the things that you're talking about, institutionalized racism, or like,
mhm,
trust breaking incidents that have happened in the
mhm,
past to people of color, or any kind of like anything that has created inequities that exist within our society.
right,
All of those things on top of that, it obviously you need to be transparent to battle all of that as an
mhm,
organization, because you're already starting with these preconceived notions that it's
mhm,
difficult for people to change their thoughts and their behaviors. But
mhm,
communications, and specifically storytelling, can be a really good vehicle to
mhm,
help people be more accepting of help, support, resources, programs, whatever it is that you're offering as a social entrepreneur as a solution. Like, whatever you're slanging as your solution, people need to buy into it. And in order to
yep,
buy into it, you're on an uphill battle of getting past the prevention problem, getting
yep,
past this whole idea of changing people's behavior, getting past this people have been harmed in the past situation, like
mhm,
all of that. And so can you talk a little bit about, like, thinking about community, thinking about organizations, thinking about people who are working in this space, what is the number one piece of advice you would give people who are trying to make an impact about how they can just start moving in that direction with their storytelling? Like, how
mhm,
can they battle some of these issues with what it is that their solutions are, to try to get their solutions out there and get them to the right people?
mhm. Kind of mentioned this before. Work beside the community, and not for the community. That's I live off of that. I live off of that. Work with them, work beside them, allow them to sometimes lead the conversation. Have the opportunity, give them the space, be that resource that they need to share their voice. It's not about you. It's not. And it might be hard, like people be like, she crazy. No, it's not. And I had to learn that for myself. It's not about me. It's not about what I want to do as a public health or a community health practitioner or a professional. It's not about me. It's about the community I'm trying to serve. So I make sure that when I'm doing my work, it aligns to allow my community that I am working with, my ideal community, to lead the story, to use their voices, to put them in the forefront so that they can better connect with others. Because ultimately, the goal is just to have that positive health outcome. That is it. So make sure you work with them and beside them. Sometimes let them lead, and you can have major community impact. Oh, I think. So I don't know where Wendy went, but if y'all have any questions or any comments for me, as I guess she's trying to come back, I guess I can do that for the time being. Okay, so if y'all don't have any questions or any more comments that y'all want to share, I don't know if y'all can still see me. I don't see Wendy, but yeah. See, let's give her a couple more minutes.
Okay, hopefully you guys can see me. We came on earlier to do this live, and Nishay and I were here doing it without you all. And then my Wi-Fi decided to just cut out, and my phone's about to die. So if you're still here as part of the broadcast, we thank you for being here. It's a weird cutout to this. We might have Nishay come back and finish this conversation because it was such a good conversation. We were getting into so many things. So if you're still here, part of this, thank you for being here. I just wanted to come on. I was able to somehow circumvent the Wi-Fi, which is still not working, and hop onto my phone in order to get in here to this feed to tell you guys to just chill out. Thank you for being here and thank you for supporting. And we will have Nishay come back in the month of March to finish this conversation. So thanks for being here, everyone. Have a good one. Take care.